was born, I had bilateral cryptorchidism, which for the listeners is undescended testicles. And I was not born in the United States. I was born in Spain. And it either was missed when I was born, or they just didn't really understand how important it was to correct that surgically, which we do now. And typically, like when a baby's born with that condition, usually within about 6 months, they want to bring the testicles down out of the pelvis, into the scrotum to prevent damage. Well, mine were not repaired till I was like 3.5. So I always knew that I would have fertility issues, but everyone, that I had seen as a kid and even as a young adult said, you won't have any issues with testosterone with that. That was what we thought at the time. Well, lo and behold, we know that that's not true. That's not true. So I presumably had pretty good testosterone levels as a teenager. I survived puberty. I was a competitive powerlifter in my early 20s and completely natural, and was able to put up some decent lifts, put on a lot of muscle. So I'm assuming I had natural testosterone levels as a young man, but something happened in my mid 30s, and I know men, a lot of men have that story. And so, long story short, I got on testosterone replacement, and I'm the kind of guy that if I'm gonna delve into something like this for myself, I have to know everything about it. So I went down the rabbit hole. I took as many CME courses as I could. I got as much training as I possibly could, and I continue to do it because I learn new stuff every day in this field, because it's I just find it so fascinating. But it radically changed my life. I got the old me back, so to speak, and it may have been placebo. I'm fully willing to recognize that, but gosh, within 7 to 10 days, I just felt like that fog had lifted, and the clarity and the sharpness that I had intellectually was back. I was able to work more emergency room shifts. My workload, I could handle it now. And I just, I not to make light of it, but I was, men with low T they get kind of bitchy and irritable, and they don't handle adversity very well. And that's not me, but that was definitely happening to me. And I noticed that corrected very quickly. Things that bothered me previously didn't bother me. I became, a much better partner in my relationship. Now, fast forward years later, I'm a much better father than I know I would have been. And I credit testosterone with all of that. So when I saw when I saw what it did for me, and I learned more about it, I recognized what a huge problem this is. And of course, it's only gotten worse. It's in the 15 years since I started treatment. I wanted to help other men, have those kind of same experiences. Because once I started asking, and once people kind of knew, they heard me talk about testosterone, they just came out of the woodwork. And I said, well, I feel exactly the same way. And I would check I started with some friends and family, of course.
Right.
And lo and behold, I was getting very similar, if not worse, numbers than these guys. And then, I was still on active duty at the time, and I was shocked by some of the low numbers that some of our deployed soldiers were coming back with. And many of those guys had traumatic brain injuries and were being put on antidepressants and some of these atypical antipsychotics. I know you've seen this 100 times, and I know you've talked about it too, but many of those guys were suffering unnecessarily, I found, and simply because nobody had ever thought to check a testosterone level, let alone a growth hormone, IGF-1 level, thyroid, let alone any of that other stuff. They were all being put on antipsychotics, antidepressants, and many times that was just making things worse. Fast forward to now, this is a huge part of my life. I'm still in the emergency room, and I'm still taking care of, critically ill and injured people. Emergency medicine is a young man's sport, I say, and I'm not getting any younger. So I, eventually will be transitioning full time into this, because it's just so enjoyable. I feel honestly, people who don't know medicine maybe can't appreciate this, but I save more lives in my hormone practice than I do in the emergency department. I think I've made a bigger dent in the universe in terms of helping people by practicing this kind of medicine than I have in the emergency room, outside of my military deployments. Of course, that's a different story.
Well, there'll be a lot.
That's kind of the origin story. I mean, that's in a nutshell how I got into this. Many of my own issues were solved by testosterone. So I'm a huge advocate